Hello, everyone. Welcome back to another episode of Testimony Thursdays. I am your host, Dr. Jas, and I have a very special guest with me today, y'all. I have Dr. Mike with me. He is wonderful. He's a wonderful physical therapist, a wonderful husband, father, friend, mentor, like all the above. And I am so excited for what we have to talk about today because I know this episode is going to be like magical. I feel like I say that about every episode, but for real, this one is going to be just life changing and inspirational. Okay. So, y'all know how we do. Let me start with the scripture before I get into more introductions of Mike. So, this is from Isaiah 54. The sovereign Lord has given me his words of wisdom so that I know how to comfort the weary. So I feel like that's important for us, especially as physical therapists, because we are seeing people who are going through life changing experiences, especially, someone who maybe living a typical life and then they get in a car accident and everything has changed. So I feel like I love to meditate on that scripture because I have to ask God to like guide my words, my actions when I have those patient interactions that can be a little difficult. So, Mike, thank you for being here. Can you just tell us a little bit about yourself? And yeah, we'll go from there.
Well, so excited to be here, Jasmine. Thank you again for inviting me on. Like Jasmine said, my name is Dr. Mike Israel. I'm a physical therapist by trade, but that's what I do, not who I am. I've been trying to teach myself that more, right? So, who am I? I am, as you said, a husband of 7 years to my high school sweetheart. I am a father to two lovely girls, Micah and Blake. So I'm a girl dad through and through. I'm starting to lose a little hair in the middle there, so I know that's what it really is. What else? I'm an enthusiastic person. I really get into when I find something I have a new interest in, I really kind of dive head first and ask questions later. So that's maybe a little bit like of a personality trait, I guess, that probably best describes me. Is kind of fearless, head-on adventure seeker. And then yeah, like I said, by trade, I'm a physical therapist, an outpatient physical therapy. I've been doing this now almost 7 years and some change. So yeah.
Wow, Mike. Oh my goodness. I already have 1,000 questions for you. Like, oh my goodness. And yes, shout out to Crystal, your wife. Like, thank
Yes.
you. Like, she is just an amazing person as well. And I'm glad, she let you have this time to get on the podcast because me and the girl,
Well, yeah.
yeah, you're busy. You're busy.
I'm tucked away in a hideaway where nobody knows where I am. So we'll say that's a blessing in itself that I can hide for 30 minutes. So
Oh, I love that. All right, Mike, we're gonna start with an icebreaker. I think this
okay.
is so funny. I came up with this yesterday. And after that, I'm gonna read something from my book. So
Okay.
yeah. So this is going to be true or false. All right. And you can plead the fifth. You don't have to answer the questions if you don't want to. Okay.
Okay.
So during my time as your student, because this is
I plead the fifth. I plead the fifth immediately.
so y'all, so me and Mike, we went to high school together, and y'all have to read my book 2.76 because I go into more detail how he became my clinical instructor, how it just became like full circle. But he was my CI. I think this was in 2021. Like, oh my gosh, that makes me kind of want to. It makes me a little nauseous. That was a while ago, but and we had a good time, y'all. We're gonna reminisce a little bit, but true or false? So there was a moment where we had a kind of like a fitness activity, and we were doing like a walking like competition. Who could get the most steps? True or false? Did I win that competition?
The step meter said true. Yes, you did. However, I really feel like you were one of those ones who just shakes their wrist, in the back room. But no, apparently you were getting your 10,000 extra at the end of a workday. So
I was doing it. I was doing it,
true.
y'all. Like,
It's
oh
true.
my gosh, that was such a fun competition with Mike and Lee and Tracy, the other physical therapists that were there as well. My next question, without saying any names, I know I just said their name, but we're not going to say who. We had a particular therapist who, when he came to work, he loved to show off his legs with his attire. True or false?
I'm gonna say true. I'm gonna say true. But to his credit, to his credit, he was the Saquon Barkley of that clinic. So, rightfully so. And I can say
Yes,
that.
definitely, definitely. And it's so funny because he actually just had a baby, y'all. He's married and he just had a baby. And I commented on one of his posts and I was like, so now that you're a dad, does that mean you still wear like dad shorts? And he was like, actually, yes, I do. And they got shorter. And I said, you know what? More power. More power. Okay. Last question, true or false? I was your favorite student. True or false?
Oh man. Let's see. You were my favorite Jasmine blocker. You were my favorite Jasmine blocker. Out of any other Jasmine blocker that I may have ever had or that ever will be, you were my favorite.
You know what? I'll take that. See, y'all, he's witty. He's quick on his feet. He's quick on his feet. Okay, let me read from my book, y'all,
Yes,
2.76
2.76.
about Mike. And this is just a great time to read it because once again, full circle moment, y'all. So I was his student like in 2021 during like Black History Month. And I have to read this. Like, thank you, Holy Spirit. So this is from page 80 of 2.76. During Black History Month, something special happened at the clinic under Mike's leadership as the clinical director. He ensured that the clinic actively participating in celebrating this occasion. This initiative demonstrated Mike's commitment to fostering a diverse and inclusive work environment. Each week, we had a different theme to honor Black History Month. We highlighted and celebrated the accomplishments of Black men, Black women, local businesses, and engaged in Black History Month trivia. During these moments, I truly felt seen and recognized as a Black woman in the field of physical therapy. The efforts made by Mike and the clinic created an environment where I felt valued and appreciated for my cultural background. Why do I feel like I'm about to cry? That is just, oh my, Mike,
Yeah.
tell us about that. Tell us about you how you got into that position as a clinical director. Like
Yeah.
after graduating from physical therapy school, where did you go from there, and
Yeah.
how did you use your power to highlight different communities?
Yeah. Well, so like I said, I graduated from PT school and then I went straight into the workforce. And I worked for probably about 5 or 6 months, honestly. And then management approached me about an open position they thought I'd be a good fit for to open up a new clinic. And it was definitely a little bit of a fearful endeavor, but I've never, again, I'm a little bit of an adventure seeker. And if I'm even a little bit excited for it, that's enough to kind of have me jump in. And so, a lot of people would think, oh, I'm 6 months out and, where's my skill set? I don't know, and this and that. But I figured, you're better off learning on the fly sometimes and just kind of diving into it and learn the lessons that come with it. So I jumped right in. 1 year later, I'm the clinic director of a new PT clinic that we opened up out in Blythewood. And then after that, I started to really kind of get used to leadership and understand what that meant, right? Not just from a metric standpoint of, okay, the business is still a business and it needs to make money and it needs to meet these values. And this is how you open a clinic. All that stuff was really exciting and new. But one thing that I had always had going through all of my matriculations from high school to college to grad school and even out of that into the workforce was I always felt like I had somebody backing me. And so I knew I want to be that kind of leader. In particular, knowing that I am an African American male and a little bit of a unicorn in the profession, right? There's not a lot of African American representation in our profession. I want to say the last stat that I looked at was less than 11% were African American. In that 11%, more than half of that was female representation. So to me, it was very important to make sure that through all of the other things that I'd done in grad school and college, where I got to, be a face for maybe a student or go to a job fair or anything like that, or even be out in the clinic and realize, like, man, throughout all of my clinical journeys, I've only ever seen one person that looked like me. How can I now, in a position of leadership and a place where I have the ability to make some change, how can I champion that, right? How can I then continue to pay that forward and try to expand on it? And so that's kind of where I really want to make a point, especially for Black History Month, to make sure that was not just going as something like, hey, it's this stock photo of an image online that says we celebrate it, but actually champion what Black History Month is, right? What representation means. How do we uplift each other as a local community and as a culture, as an ethnicity, et cetera, and inside of our profession and outside of that, right? Because PT is much bigger than what just happens in the clinic. So, and yeah, and then I've continued that tradition ever since. Every year, starting this month here in February, we continue to raise awareness on certain Black history figures, whether they're clinical and medical in the profession or those outside. Again, wherever I am in the state of South Carolina, in that community, I try to champion those causes.
Wow, Mike, that is awesome. And you just being like a leader, what advice would you give someone that, maybe they're getting a little pushback on celebrating Black History Month? Or did you ever get any pushback from higher ups? Or because you were the clinical director, like you had more power to have say in those things? So, what advice can you give us?
So luckily, I had a very supportive management staff, right, and a very supportive mentor. And he very much, when he heard that I had the idea to do it, he was really on board for it. He wanted to know how we could mirror that in other clinics across the state, not just for Black History Month, but for Latino Appreciation of History Month and other minority groups. How could we also uplift those? So he was really on board for it. To those who maybe do get some pushback, I would say it's okay to push back, right? If you get some pushback, it's okay to push back a little bit too. There's obviously a little bit of a professional coop that you have to keep, right? And you don't want to do anything in an offensive way, obviously, but I do think that there is a way that you can show representation of what matters, and if that management and that company really values you not just as a clinician but as a person and what you bring to the table, they typically should value all of you and everything that you bring. And so, like I said, I've never gotten any pushback from it on any of my leadership throughout my career in any phase. And I highly encourage those who maybe have just the idea they want to do it or something they think that they want to talk or speak out a little bit more of to do it. And sometimes this is probably bad advice from leadership, but do now and ask for forgiveness later, right? Just try it. Just try it and do it. If you're not in that position where you are comfortable doing that, or maybe in a leadership position to do it in autonomy, just ask. Just ask, and more often than not, you're going to get the 100% go for it because they're just waiting for somebody to step up.
Yep, yep, that's so true. And it's important, like how you said, to have that professional attitude and that emotional intelligence. So something too that stood out to me for like during my clinical rotation with you, I don't even know if you remember this, but during that time, it kind of reminds me of the times now where like racial tension is like increased, like division is like increased, and people are kind of trying to like navigate through that. And I remember like one time it was a patient that came in, and during this time we had to wear masks. Like it was just a different world. We didn't know what was going on. Like we're trying to protect everyone.
Yeah,
And I remember this man, he came in and he was like, I'm not wearing a mask. I'm not putting that mask on. And I remember you were just so elegant and poised. And you were like, listen, this is our policy. This is what we have to do. Like, I understand where you're coming from, but this is how we protect you and we protect other people as well. And he was just agitated. He was raising his voice. And I just remember thinking, like, wow, like Mike really handled that so well. And this is why he's a clinical director, because at like now I'm definitely, I'm getting to that point in life where I'm more mature. But back then, oh, I was ready to risk it all, especially because of what was going on with everything. And, I'm not gonna say, but he was, yeah.
yeah,
And I was ready to just be like, you know what, sir, you can leave. Like, we're giving you care. We're helping you. You just had surgery. Like, we're trying to get you better. And
yeah,
you have to wear a mask for maybe 30, 45 minutes. We're in here all day trying to wear a mask. So
yeah,
I just appreciate that example that you had for everyone on being able to handle that situation when it was uncomfortable for everybody in the clinic. It was like, what do we do?
yeah,
So yeah, that was a great example of how you were being professional in keeping everything together.
yeah,
So
yeah. Yeah, I'm glad I could do that, right? I always believe in lead by example. So if I'm gonna say something or do something, I expect to hold myself to the same standard. And one of those big things is never let anyone get you out of character, especially in your professional setting, right? Because you don't know who's watching. It could have been that, to your point, that interaction could have gone another way, but that definitely might have had an effect on how my other patients might have seen me, how my students would have seen me, how my associates would have seen me. And I didn't want that impact, right? I'm a big believer in impact. That's one of my mission. That's part of my mission statement in life, actually, is how can I impact others in a positive nature? And in those types of interactions, how you impact others, sometimes it's just leading by example and how they see you, right? So sometimes it's not necessarily what you do for them, but what they see you do for others.
Wow, Mike, get out of here. And y'all, Mike has been like this since high school. Like, I'm just like
No,
for
no, no, no. Don't overcredit me. Don't
no,
overcredit
I
me.
remember one time in the clinic, you told a story like about how you got in trouble in high school because you had crystal in your car and you weren't supposed to have anybody in your car. And I was like, that's the worst thing you did in high school. Like, I was out of control. And it was just like, I remember Mike was on a football team, y'all. Like, he was just someone that was very much so like a good example to follow. And I should have had more friends like Mike in high school because I was definitely leading a double life. And I talk about that a little bit in my book, how I was just, I was giving into that peer pressure and all that stuff. But it's important to do the right thing even when nobody is looking. So I feel like, especially for me now, being a physical therapist, I talked about this in a previous episode, how I don't want to get into that space of where so and so is doing it like that. So I'm going to do it like that. And it's like, no, like our patients deserve the best treatment and like the best care. So I definitely try to treat everyone as if like this was my family and what type of care would they need from that. So it's all about having that integrity. And I feel like people, we lack that and we kind of get burnt out and then all of those things happen. But Mike, what is your current position now? Are you still a clinical director?
So I'm no longer a clinical director. I'm actually a regional therapy director. So I moved. I'm with an orthopedic practice here in South Carolina. Oversee 4 different locations throughout the state, and I'm still clinical, so I still do get to treat, but I also have a little bit more managerial role and directorship. But it's fun. It's fun, and I enjoy what I do. I still love what I do. I love the people that I work with. I love the patients I interact with. And yeah, it's definitely been a positive experience all around.
See, y'all, Mike is so humble because that was my little toss. What do you call it in the basketball when you want somebody to toot their own horn?
You lobbed it up for me. Yeah.
Yeah, that's what it was. And you know what? I actually talked about this in my book too as well. So this is when I talk about his humility. One of the things that stood out about Mike was his humility. He never spoke down to me, and I genuinely felt blessed to have him as a mentor. Another aspect that contributed to Mike's effectiveness as a CI was his constant thirst for knowledge. And I'm like, even now, y'all, he's talking about that right now. Like he's saying, there he's gonna figure it out. If there's something he's interested in, he's gonna go for it and he's going to do it. And even for me, like he pushed me to do that as well. Like he would constantly like quiz me in the clinic. I had to do a bunch of hands-on skills, special tests. I got to do dry needling on him. I can't believe he let me do that. I haven't done that since Mike. So
I still ain't walking right, but it's okay.
right. I'm like, oh my goodness. Like too, were you a professor or a guest lecturer for a physical therapy program?
Yeah, so I've done a couple of things also outside of the clinic over the last couple of years. I've gotten to help with some grand rounds actually, and be a um, expert, I guess, in orthopedics for a few HBCUs during their grand rounds for their PT programs. I've gotten to go back to actually my alma mater, MUSC, and do some DEI work with them for about a year or so and help to continue to try to matriculate minority students through their doctoral program. And then here more recently, over the last couple of years, I'm an adjunct professor, and I teach kinesiology and therapeutic activities in a PTA program here in Columbia. So that thirst for knowledge never stops. I'm always looking to see what's the next thing I can kind of dive into in that realm, right? To make sure I stay sharp in my own skills because it is really easy to become a dinosaur in this profession because so much changes so often. And so this really helps me keep a good foothold in the literature and in the newest research and making sure that I'm treating at top of my license.
Wow, Mike, what don't you do? Like that's amazing. That's phenomenal. And we need more people like you that are physical therapists that want to continue to learn so they can stay sharp, like how you said. And during my time as a student of Mike's, this is a very funny story. I post on social media, like I do content and stuff and talk about what I do and like educate people about physical therapy and all that stuff. So Mike was teaching at one of the HBCUs. I won't say which one, and I had somebody message me, y'all, and they were like, "Oh, my goodness, is Mike your CI? He's our professor. Is he single?" And I was like, "Mike is happily married. Like, what?" I was like, "Why would you even ask that?" So it was, yeah, it's a small world, and physical therapy, especially being Black physical therapists. It seems like everyone knows everyone, and yeah, that was just that tickled me a lot. So, Mike, what is like your so I know you said impact is like your what you want to do for inspiring others with your
Yeah.
career inside and outside of physical therapy. But what is like your dream like career or dream job? Or are you working in that dream? Or what
Yeah.
is something that you can just see for the future that you want to obtain?
Yeah. So it's so funny. I think you start out with the dream, right? The dream, I think if you ask me getting out of school was to work in outpatient orthopedics and be the best PT. Okay, cool. Done that. Maybe not best PT, but I did work in orthopedics. Cool. Now it's, I really want to like see what it's like to run a clinic and kind of go that route. Did that. And then it's okay, dibble dabble with maybe private practice and see what that's like. Haven't got to dibble dabble in that yet, but I think in the roles that I'm in all these leadership and directorial positions, it's given me the taste of what that's like. And I do still think that's on my dream path. But I think the funny thing about dreams is, they're only dreams until you start to take action on them. And so I would say, to your point, I think I'm actually living out my dreams a little bit of doing what I want to do. Right. And I think at the end of the day, it's not necessarily one specific thing. I think it's just having autonomy to feel like I can treat the patient population I want, that I can work in the places that I want to be in, and have that autonomy to say, yes, I want to work this way or I don't, and have those options maybe. And then to your point, and again, to be able to impact, right? To be able to impact those. And I think that's the ultimate dream is what lasting legacy or what lasting impact am I leaving on the people around me, right? My patients, again, my students, my CI students and my classroom students, right? My family members. I mean, all those people I can affect in a positive way. And so I think that's my ultimate dream is to leave some sort of impact here and let my name be branded on the field in a positive way. And I think right now I'm living through that. What that ultimately will end in the next 30 to 35 years before I decide to hang up that white coat, who knows? But I'm along for the journey to find out.
Uh, Mike, I tell you, we have to get you on like a TV show or something. Like this has just been so motivating. Like you are just so well spoken. So thank you for that. And I feel the same way, and I sometimes I'm like really hard on myself because I don't want to get complacent. Because right now I'm content. Like I love what I do
Yeah.
for work. I love waking up every day and say, "Oh, I'm going to work." I work virtually and I work in person, and I love the flexibility that I have. I get to do speaking events. I love having this podcast.
Yeah.
Um, there's so many things like being a mentor. I was a CI as well, and that was just an amazing experience. So just being able to have the like that autonomy, like how you said, and do things that I'm passionate about, I feel
Mhm.
like living out my dream. And I just don't want to be like, oh, I'm so comfortable, and then I don't like dream for something else and take action for that as
Exactly.
well. Um,
Exactly.
so yeah, just keep on keeping on. That's what we're gonna do.
That's it.
Yes, Mike. Thank you so much. This was an amazing episode. Like I really had a
Yeah.
really good time with this episode. And how we end every podcast, we talk about a test that we went through that has led to a testimony, or a test that we're currently going through that's going to lead to a testimony. So I'll let you
Yeah.
expand that.
So, and it's funny when you were prepping me a little bit, and you told me that was the thing. I really had to stop and think, right? It's like, well, what testimony do I have, right? It's like, man, what have I been through that's really challenged me and then changed me for the better? And to be completely honest with you, no, life is never perfect, right? And we all have our ups and downs. But um, if I can, and I know it's a faith-based podcast, if I can speak to the glory of God, I'm one of the maybe few individuals in this world who can say that I can't really think of anything huge that I've gone through as far as a test. And I think that is my testimony, right? That God has been so good to me in my 31, almost 32 years of life, that He's given me nearly everything I've ever wanted. He's always given me everything I've ever needed. I've been blessed to have a family that loves me and supports me. I've been blessed to be able to impact those in a positive way around me. I've been able to spread the good word of Jesus Christ throughout my community and those around me as well. I'm a true believer. And I think becoming a little bit more, mature in my faith, I've learned to realize that even when I pray, right, I don't pray for just the things that I want or ask God to, get me out of a situation, but it's more of God, whatever the situation that I'm in right now, help it to change me in the way that you deem appropriate, right? Help it to make me into the man that you want me to be. And I think that's becoming more mature in your faith. It's not just get me out of the fire, but help me get through the fire. Let me be Daniel in the cave of lions and allow me to experience those things so that then I can come out of the other side a better man for it. And ultimately, right, I've got two little girls. So I want to make sure that they understand what it's like to have a strong man of God in your life. And that, includes all my nieces, nephews, little cousins, and all those around me. My wife, right, being a good example and leader for her as well. So I think that's my testimony, right, is that thank God I haven't gone through anything that's too earth shattering of a test. And should it ever come, I know that I'm fully prepared for it because He never give me something I couldn't handle. Right.
Mike, I'm gonna have to go ahead and end this podcast because I'm gonna start crying any second now. And that, like how you said, that as a testimony because the anointing over your life, like God has kept you protected, God has kept you covered. And like I said, I can go back to high school and like you have always been obedient. And of course, there's things that, every like high school student goes through and
Yeah.
stuff like that. And we weren't like that close in high school, but just seeing you like on the football team, like seeing you as a student, seeing you in a relationship with Crystal, like it was just like I felt like you didn't remove yourself from that covering of God's
Yeah.
love. And that's what keeps you going. And that's a testimony, like how you said. I feel like certain people, sometimes we're like, well, I need to do like I need to do this or whatever, and that's gonna help me find myself or this and that. And it's like, no, like stay under that protection. So
Yeah.
thank you so much for that, Mike. Oh, I'm so excited to post this episode.
Yeah.
Thank
I'm
you,
excited too. Thank
everyone. Oh my
you for
goodness, Mike.
having me.
Yes, and you know what? And this is Mike is not a stranger to a podcast either, y'all, because I listened to one of his podcasts before too, and that has helped me as well. So we got to get you back on that podcast journey.
I know. We're definitely talking about it. So we may have some new stuff upcoming.
Yes.
Um, but yeah, we love the podcast world. So
Well, thank you so much. Thank you all for listening. Please like, comment, share with someone that would benefit from this episode. And thank you for joining us for another episode of Testimony Thursdays. Bye.